although there's lots of ret words being said here, the grandmaster is
I followed a circadian skincare routine my whole life without even realising that
it's not if it's going to work, it's when it's going to work.
we've all been there, Emma. We've all been there.
So when we think about these wonder drugs, I mean, in dermatology, Tretinoin. So retinoids is a blanket term essentially for vitamin A. And the reason why everyone in the skincare world loves retinoids is because back in the late 80s, it was discovered that by applying a prescription form of retinoid or vitamin A called tretinoin onto the skin, it essentially reversed the appearance of age and wrinkles and pigmentation in the skin. And back then, everybody got very excited about this and started doing lots of studies on what it looked like if you applied these strong versions of a retinoid to the skin. And they did lots of studies that took samples of the skin. They looked at how the collagen was made. It looked at how the elastin was made. It looked at the dermis, the epidermis, and concluded that by applying this strong version of a retinoid, that it made the skin look younger and you had better skin health as a consequence. And so on the back of that, there were then derivatives from this tretinoin, essentially, that is marketed in traditional skincare. And so we think about these terms of something called retinol, which you would hear quite readily used in skincare, retinal or retinaldehyde. There's things like retinyl esters, palmitate esters. And then there's other versions of these retinoids that you might hear terms called bakuchiol. Now, all of those versions of the retinoid are really derivatives of the grand master, which is retinoic acid or tretinoin. So although there's lots of ret words being said here, the grand master is the retinoic acid, otherwise known as tretinoin, and that's a prescription product. And then the derivatives downstream from that are things like retinol, retinal, retinyl palmitate, and they essentially have to be converted by your own body to try and become the grand master of retinoic acid, which is the molecule as such that interacts with the skin cell and switches on the right genes that are youthful genes so that your fibroblasts start making more collagen and elastin, your skin cell turnover happens a bit more quickly, and you get more of a glow to the skin, and the skin essentially thickens overall, so it becomes younger. So that is the topic of retinoids in a nutshell. I think it's always really quite complicated because so many of the words sound exactly the same.
They all sound the same. And then people are like, oh, but I'm already using tretinoin. It's like, no, you're not. You bought it over the counter. It's not tretinoin.
I mean, you must be the same with journalists. You get asked all of the time, you know, what does retinol do for the skin? And is this confusion where people think that retinol or retinal, which is the thing that you buy over the counter, is the same thing as what these large-scale studies did on the actual prescription drug. So we think of retinoids or all of those things I just described, but the thing that shows better aging of the skin is the retinoic acid, which is tretinoin. Adapalene is a prescription drug. It's mainly got a license for acne, but it has also been shown to have some better aging effects. Tazorotene has also been shown to have better aging effects. It's another retinoid that was used originally for psoriasis, and they all have better aging effects on the skin. But the thing that we think and is formulated and has probably got the best evidence is actually tretinoin.
And tretinoin works, as you say, directly on those retinoic acid receptors, leading to all of those amazing downstream benefits in our skin. And retinol just takes 2 conversion steps to get there, to act on those retinoic acid receptors, and retinal takes 1 conversion step. So if you think of retinol is a little bit weaker in that it takes those 2 conversion steps, and retinal probably is a little better in terms of the over-counter preparations that you can buy.
But if you were going to try and compare these head to head with the actual prescription form, the tretinoin, it is far stronger. And often I think some people think, oh, because it's stronger, it's going to have more side effects. But I see a lot of side effects with people who are using things like retinol, trying to get it up really strong, but then you run into side effects because your skin still has to do the conversions of it. So you run into problems that way.
Yeah, I was never able to tolerate retinol or retinal, but I was able to tolerate tretinoin.
Exactly the same for me. So I have rosacea and I could never use retinol or retinal, but actually the right kind of a very potent the drug version of it, just using smaller amounts, but is still stronger, actually does the job perfectly.
Yeah, same.
Also, as well, it's not just about what the drug or the ingredient is, it's also about what the dose is of that ingredient, because you might be buying something over the counter that says it has retinol in it, and it might just be a little homeopathic dose of retinol. I mean, it's going to be loud and proud on the packaging, but actually it might just be a tiny little bit of something that's never going to do anything. And equally, you might then be wanting to go very strong with your retinol and actively seeking out the highest concentration. But even that, you have to be a bit careful, because quite often it can be a bit misleading, because they make these retinol complexes that look like you're getting a very high concentration of retinol, but actually, because it's in a complex, the amount of retinol you're getting is much smaller than what it's being marketed to you. And then the same thing holds true for when it gets to the prescription retinoids. So something like tretinoin, it's important to know that you really need to be on a dose that's more than 0.025% if you're doing that for better aging reasons. So a very tiny amount that sometimes people are kept on. Yes, you'll be getting a bit of benefit, but not in the same way that all of those studies did, which were actually mostly done above 0.05.
Yeah, I think I always see the 0.01 dose of tretinoin as like your stepping stone. You're building up your tolerance, gradually trying to get there, and you will build up your tolerance with consistent use of it. And then you can just keep going up and up and up in terms of the potency and dosing.
Until you're so strong.
Your skin's so robust.
How do you start using something like this? It can be a bit tricky at the beginning, right?
Yeah, so I mean, I'm on Clearer, as everyone knows. And so the genius of Clearer is that it comes in a beautiful formulation. So it's actually well tolerated, but also it gets delivered every month. You get this little cartridge in a beautiful glass bottle, and you just do 2 pumps of this prescription cream onto your face. And you start at a low dose, 0.01, and every month you get slightly different components within the cartridge. Every couple of months your dose is gradually going up, so without you even thinking about it, your tolerability to tretinoin is increasing and improving. But you don't need to think about it so much. You're not sort of, oh, did I use my tretinoin last night or did I not use it? You just know every single night you're using your Clearer, and every single night you're building up your tolerance to tretinoin.
Do you remember the older days whenever you would give somebody a prescription of it and they would have to, you'd say, okay, put this on every 5 days for 3 weeks and then every 4 days, and then to try and build it up that way. And it was so confusing that you would forget. So that is one of the things that actually my patients love about the way that Clearer does formulate it, because it does just go up gradually bit by bit.
Yeah, and it's all about habit stacking and trying to incorporate using your retinoid at night. I followed a circadian skincare routine my whole life without even realizing that there's this buzzy word of circadian skincare. So this is where you tend to protect your skin during the day and you repair your skin at night. So tretinoin is a wonderful repair ingredient because it helps to repair a lot of the damage and the stress that's on our skin cells, and really does help your skin be the best version it can be.
There's very good evidence for showing that that's the way around to do it, because certain enzymes are active in the day and certain enzymes are active at nighttime. And it is that real protection that's happening in the day that your body's trying to do to protect against, DNA damage. And then at nighttime is whenever, you're asleep in a dark room and there's not much chance of damage, that other enzymes switch on to try and go, okay, right, let's start repairing all of the issues that have happened in the day and get things strong again. And so if you're applying your treatment at that time, well, it's all of the right building blocks in place just to help it work. But there are some issues that happen with it, and especially people, so somebody like me who has a very sensitive rosacea type of skin, then, which I don't really have any problems with now, but because I've been using my Clearer for so long. But at the beginning, people can run into issues with dryness, and sometimes a bit of over exuberance ends up meaning that you put more on than you really need to. But you can get bits of red and scaliness around the nose and around the mouth.
We've all been there, Emma. We've all been there.
Been there. It takes some time, because that is one thing that can happen. And the other thing that can happen that sometimes puts people off is that if there's somebody who's prone to, like blackheads particularly, or little spots around the chin area, then it can take a while for those blocked pores to work their way out. And actually sometimes as they're working their way out, they get a little bit inflamed, and you can sometimes get more spots at the beginning than you would necessarily have expected. And those spots are often can last a bit longer than a normal spot might do. So I always say to people in that situation, whatever you do, don't pick them because you'll just set off a little pore nearby. If you can get those zit stickers, the hydrocolloid ones, and put one over the top of it to allow it to heal, don't pick it. And it will just in time have worked its way out. When people have been consistent with that, then you stop getting those little flare-ups that otherwise might have been problematic for you for many, many, many years before you have got onto your retinoid.
The other problem people can encounter is when the seasons change, if it's suddenly the temperature drops and the humidity levels drop, and then it's cold, it's windy, and you might just notice it needs a bit of an adjustment. What I normally do is I say to use a moisturizer sandwich technique, moisturizer before, moisturizer after, and then as time goes on, you can then remove that buffering with the moisturizer and go back to where you were. But you might just need to adjust things for a couple of weeks just whilst you're adjusting to that temperature change.
Yeah, and I would say because you exfoliate overnight because of having the tretinoin on, and particularly then in situations like you've just described where the skin is a bit drier and can sometimes be a bit scalier, it's really important that morning step of cleansing all of those dead skin cells away before you then put your heavy moisturizer on, because otherwise you'll have bits of dead skin cells sitting around, not cleansed away properly, putting on your heavy moisturizer, because that's the right thing to do, but just not over the dead skin cells. And then that sets up almost like a slightly altered environment that different kind of microbes might want to reside in and cause inflammation. So I think that really important cleansing step properly to get the dead skin off before the moisturizer is also key.
Good tip.
I think those are the main issues that people run into with starting a retinoid.
Yeah, and also like too close to the eyes, the nose, and around the mouth. So I tend to just put a little bit of moisturizer in those areas just before I even put my tretinoin on.
I don't know. I just like right up to the eye line, not in the eye.
You're a retinoid pro. Queen retinoid user.
So when somebody asks me about the changes that you would expect to see over time, I always kind of say, this is not like a normal kind of skin routine in the sense you're like, is this going to work for me? Am I going to see a difference? The answer to that is always yes. It's not if it's going to work, it's when it's going to work. And it doesn't work quickly because one of the main things that people love about using a prescription retinoid is this idea that the cells that make collagen have been switched on, so you're making more collagen. And that outcome is really seen at around about 9 months. So it's continued use at that dose for 9 months to see this effacing of lines and wrinkles. You also see a reduction in pigmentation around about 6 months. But do you want to talk about the glow?
Oh, I love the glow you get with
That comes
tretinoin. It comes quickly, but I'm not sure if it's just the clearer formulation being gorgeous, and that's why I look so glowy when I use it. But it does come really quickly. You just look more radiant. Even if I'm feeling like my skin's looking a bit dull, I've not had a good night's sleep for a while, kids kept me out, then I will just be, well, sometimes a bit over exuberant in my clear application.
But I think that's because the retinoid acts as an exfoliant. The stratum corneum, which is that very top part of the skin, which can sometimes look a little bit duller, particularly if we haven't had a good night's sleep or we've been a bit more stressed, or with age and time, it just doesn't kind of be made in quite the same way. So you're not reflecting light from that in a very organized way. And so once you've been using the tretinoin, which acts as a chemical exfoliator, it ends up leaving a very kind of smoothened stratum corneum. And so when light hits off your skin, it bounces off. So you do get this, well, you get
you've
your
got
glow.
the shiniest.
You glow.
You're literally glowing queen.
You're glowing queen. But what I'm talking about is the skin longevity benefits of a topical retinoid, and that's used for people who have accumulated enough damage from UV exposure over the years. It's not something that you would be doing as a teenager or a younger person. That's not necessary. But retinoids are the #1 treatment for people who have acne.
Oh, by far, by a country mile in terms of topical treatment.
Yeah. So when we think about these wonder drugs, I mean, in dermatology, tretinoin, the retinoic acid stimulators are kind of our #1 drugs because you're using them for acne right the way through to better aging and skin health.